I'm Jane Williams. This is the Red Eye Podcast. In our show today, I talk with Dr. Anna Banerjee about the kind of help isolated Indigenous communities need in their fight against COVID-19. A group of Indigenous leaders and healthcare professionals say the federal government must provide more resources to fight COVID-19 in Indigenous communities. They say that First Nations, Inuit, and Métis are among the most vulnerable Canadians and the least equipped to deal with the COVID-19 pandemic. Dr. Anna Banerjee is one of the signatories of a petition to the federal government calling for urgent intervention. Dr. Banerjee is co-chair of the Indigenous Health Conference. She's a pediatric infectious and tropical disease specialist and has been studying lower respiratory infections in Inuit children for over 20 years. Dr. Banerjee joins me today from Toronto. Hello, Dr. Banerjee.
Good morning.
Do we know how many cases of COVID-19 there are right now in Indigenous communities?
I don't know right now what the current statistics are. All I know is that it's starting. I know that in northern Quebec, it's starting, and then in Nunavut and in northern Manitoba, northern Ontario, it's just starting. I think a lot of these communities have tried to lock themselves down. They've tried to restrict flights coming in and out or put up roadblocks so that not all non-essential travel is not allowed in. So I think there hasn't been huge outbreaks yet.
Now, you've visited a number of communities over the years through your work. Can you give us a picture of the living conditions that you've seen?
I've been from Haida Gwaii to Nain and many Indigenous communities in between. I've been to the Arctic 40 times. Every community is different and the resources or the lack of resources is different. But in general, almost all the communities I've seen, there's been severe overcrowding. Some of the communities don't have access to clean water. Most of these communities that I've been to have been fly-in. So they have maybe one health station where there could be a nurse. Rarely is there a doctor, but there's usually a healthcare provider. But in some of these communities, there's no healthcare provider at all. There's usually quite significant poverty in many of these communities as well. There's a lot of food insecurity. So you've got a lot of populations where their nutrition is not perfect. So there's a lot of predispositions for infectious disease or other disease in these communities.
So when people in isolated northern communities need to go to a hospital before the pandemic, where would they go?
So they would go to either regional or tertiary hospitals, depending on what the need was or how sick they were. So in these communities, they would have to call for an air ambulance, a medevac team. It could take a few hours, or sometimes if there's a snowstorm or windstorm, or if there's multiple requests, it could take several days. And we've heard of situations, for example, with my research of RSV in Inuit babies, we've heard stories of a parent or two parents and a nurse giving bag and mask ventilation. So with a mask on the baby's face, giving them breaths over a course of a couple of days until the medical evacuation team comes. So it can be very, very stressful when someone gets sick because there can be long delays.
And RSV is the respiratory condition that you've been studying?
It's respiratory syncytial virus. Inuit babies in many parts of the Canadian Arctic, especially in Nunavut and the Kitikmeot area in Nunavut, as well as northern Quebec, have very high rates of admission for respiratory syncytial virus. It's the number one reason for admission to hospital in babies. For babies around the world, it's a very common thing, but it's disproportionately represented in Inuit babies.
So you have, just by nature of your research, a lot of experience in studying what a respiratory virus would look like if it hit the north.
That's right. And the preliminary studies have shown that when you have something like RSV and then on top of that you get coronavirus, the risk is 5 times higher for severe infection.
We know that people with health issues are more seriously affected by COVID-19. Apart from RSV, what are the particular health challenges of people in Indigenous communities?
There's all kinds of health challenges. Basically, in most communities, Indigenous people are overrepresented in every health category. So there's higher rates of chronic obstructive lung diseases, higher rates of diabetes, cardiovascular disease, obesity, rheumatological diseases. And some of these diseases, people are put on medications that decrease their immune response. There's higher rates of cancer, and often they're diagnosed later and with more advanced disease, or more people, because there's higher rates of cancer, there could be people on chemotherapy or other medications that decrease their immunity. There's also higher rates of tuberculosis, astronomical rates of tuberculosis in the Arctic, where it can be up to hundreds of times higher than the South. There's also elevated rates of mental health conditions. There's an extremely high rate of suicide in some communities, especially with the youth. So basically, every condition is disproportionately represented in many of these communities. There's some communities that are doing very, very well, but that's the exception.
It sounds like a potential for a disastrous situation.
It is. The alarms are being raised by many people, including myself, many Indigenous leaders. We know from the past history, well, first of all, you have people who are compromised. You have people with underlying chronic conditions. There are the elders, and all these people are at risk by their demography. But then on top of that, you have the lack of health service, the delays in getting medical attention, and the lack of hospitals. And we also know that from the past, when smallpox came to Canada, it decimated certain communities. Like some Inuit communities, almost everyone or everyone in the community was killed. We know that for H1N1, that First Nations people were 6.5 times more likely to end up with severe H1N1. And so, for multiple reasons, this is really the perfect storm. And there's been a chronic lack of funding for healthcare, for food, for infrastructure in these communities, basically ever since we've had Canada. And so, when you have this chronic lack of funding for basic infrastructure and resources, then you compound it with a virus like coronavirus 19, COVID 19, it could result in many deaths.
In the petition to the federal government, it's calling for increased healthcare capacity in communities. What could that look like?
So basically, the petition is saying that the Indigenous leaders, the mayors, the chiefs, the elders have a lot of knowledge on their own community, and so we're not telling them exactly what they need to do, but something needs to be done. Some kind of realistic plan on how to manage this. For example, each community should have access to rapid testing. The rapid testing should be prioritized because you have these communities where there's severe overcrowding. So if one person is positive, you want to know that right away so that they're not spreading it to other people. And you want to be able to test their families and make sure that their families are in isolation. So rapid testing is important. People need to have the skills to do the rapid testing. Then you need people to do logistics. So in a community, what resources do you have? Where can you put the sick people? Where can you keep the healthy people? Where can you put the people who are vulnerable, the elderly, or the people with cancer or other chronic lung disease? Is there a way of segregating them out when there's an outbreak going on? So logistics people to say, okay, well, this community has a school, this community has an auditorium, this community has a culture center. We can use that to keep the sick people in. People with coronavirus, but that don't need to be medevaced out. And then, so we need people to help set this up. So putting up the cots. Do none of these facilities exist? Do we need to have a field hospital? Again, looking at each community, where are we going to put the sick? Where are we going to keep the people who potentially have been exposed? So manpower to do that, and then healthcare manpower. Many of these communities need additional nursing, physician support. So it could be a nurse, practitioner, nurse, but also people who know how to manage ventilators. I think one of the ways we're going to save lives is if we have these kind of mini hospitals in place, field hospitals, so that people get really sick and there's not enough medical evacuation teams to transport people down. We can put people on life support while waiting. So it means transporting ventilation equipment and people that know how to manage it. The chiefs of Manitoba have said they've been talking to Cuban doctors, and Cuban doctors, they're fully trained. They know how to manage these kind of crises. They can go in and help with the ventilators. They've been in discussions, I think, for several months, even before coronavirus started, because there are long-term chronic shortages of physicians in the community. Some community chiefs are saying, we want the military, we want the medical military, or we want the armed forces to come in and help us. Other communities saying, well, keep the armed forces out, we'll take anyone else. And I think that's a community to community decision. There's a lot of history there. There's a lot of harm that's been done by governments, RCMP in the past. And so the communities can say, who can help? To me, this is the biggest health crisis in 100 years. We know that this is a population at risk. So why not ramp it up like you would if there was any other emergency in another part of the world? Maybe get the Red Cross, maybe put a call in for physicians and nurses or nurse practitioners, respiratory therapists, because what we're witnessing in these long-term care facilities, where a very high percentage of the elders have died, that was predictable. So just like we don't want to make that same mistake again, I think now is the time. Actually, in the past several weeks before, we should have started acting, making plans, so that what are we going to do when the coronavirus finally gets into these communities? How are we going to react? We don't want to react after the fact, that the outbreak is out of control. We need the response right now, and planning right now, especially if we're bringing in other people into the community. There needs to be time to make sure that they've been in quarantine, that they're not making a problem even worse. Now, I've heard Dr. Tam say several times she's really worried about Indigenous communities and that there could be a high mortality rate in Indigenous communities based on H1N1 and the chronic resource poor conditions in these communities. We know that. And we also hear people talking about collecting race-based data. So what is the rate in Indigenous communities? We don't want to do this after the fact and say, Indigenous communities were really at high risk, and there was 10 times the mortality as the Canadian average after the fact. It almost is like this complacency that this is what we expect and this is what will eventuate. That's not the message that needs to go out there. The message is, just like other Canadians, we recognize certain groups are at risk, like, people in long-term care, prisons, but also the Indigenous population. And we need to start now with an emergency response and do the best we can to try to save as many lives as possible.
What's your reaction to the money that the federal government has offered so far to Indigenous communities?
It's a certain amount of money they give to certain communities for certain projects. It's a drop in the bucket. What we need is a real response that all communities, not just some communities, all communities have adequate personal protection equipment, gloves, masks, hand sanitizers, especially for the healthcare providers. But we need an upgrade in the number of people that are healthcare providers in these communities. It should be systematic all around, and I don't know what the Indigenous leaders or the communities are planning at a high level. I don't know what the plans are, but what the government's offering now is a fraction of what's needed. And then a couple of days ago, the federal government said, well, we'll give money for Indigenous businesses. Well, you can't have Indigenous businesses if you don't have Indigenous lives. And so we need to put the emphasis on trying to keep as many people safe as possible.
How would I point people towards the petition that you're asking people to sign?
It's change.org/COVID-19 Indigenous.
Thank you so much for talking to me today, Dr. Banerjee.
Oh, thank you so much for getting the word out. I really appreciate it.
I've been speaking with Dr. Anna Banerjee, co-chair of the Indigenous Health Conference. Dr. Banerjee is a pediatric infectious and tropical disease specialist and has been studying lower respiratory infections in Inuit children for over 20 years. And she joined me today from Toronto. The Red Eye podcast is produced at the studios of Vancouver Co-op Radio. You can support us by supporting Co-op Radio. Go to coopradio.org and click on the donate button. Independent media relies on the support of people like you.